This deep dive is adapted from a clinician-written article on Mentalyc, and we're bringing it to life in audio for therapists who, prefer listening on the go.
The piece was written by Gargi Singh, a psychologist, and we're really excited to feature their perspective here today.
Right. And since the article does come from Mentalyc, it probably helps to know it's a clinical intelligence platform. It's designed to support therapists with things like documentation and deeper clinical insights.
And today, we are tackling a moment that I think every single therapist experiences, and which can feel uniquely, well, frustrating. We're talking about the client shutdown.
Oh, you know that scenario. You've built a really strong rapport, you've hit that rhythm, and the client is finally leaning into some truly difficult stuff.
And then, bam, the system just goes offline.
The flow just stops. Your client's gaze drops, their answers get really short, monosyllabic, or they just seem absent, staring right through you.
It feels like hitting an invisible brick wall. It really does.
It does.
But the sources we're drawing from are so crucial in reframing this. They urge us to see these shutdowns not as, resistance or a roadblock, but as a doorway.
A doorway. I like that.
Yeah, because if we approach that sudden stillness with care, with the right frame, it can lead to the most profound healing opportunities. We just have to understand what's behind the locked door.
I think that's the most important reframing we can do for ourselves as clinicians, because we've all been taught that silence isn't always resistance.
Right.
But the biology behind why they go silent, that's what changes the clinical approach entirely.
That's the core insight.
Yeah.
The shutdown is not rudeness. It's not stubbornness or some conscious attempt to derail the work.
It's protection.
It is pure, unadulterated, automated self-protection. The system decides in a millisecond that the vulnerability is just too overwhelming, and so the organism retreats.
And this is where we need to bring in Stephen Porges. Our nervous system is wired for survival first, conversation second.
Precisely. We all know fight or flight, right? High energy mobilization. But what if fighting or running isn't an option?
Which in a therapy office, it's not.
Or for a child relying on a caregiver, it never is. The system defaults to immobilization. This is what we call the dorsal vagal response. It's the oldest part of our autonomic nervous system just taking over.
Can you break that down a bit? Because when we think trauma response, we often picture high arousal states like panic or anger. What does this low energy freeze actually feel like for the client?
It's a total energy drop. Fight or flight is sympathetic activation. Dorsal vagal is parasympathetic overactivation. It's what you see when a prey animal plays dead.
Wow.
For the person in the therapy room, that translates to feeling foggy, numb, detached, heavy. Their heart rate might even drop. It's a biological pause to conserve energy and minimize pain. And it's all happening way below conscious awareness.
That distinction that it's a system response, not a cognitive choice, is so critical. It changes everything. You can't talk someone out of a neurobiological state.
And that response is often deeply, deeply integrated, especially for trauma survivors. For many, that shutdown was their most successful survival tool during early, overwhelming times when escape just wasn't possible.
So the body holds on to that memory.
It does. So even if the rational mind knows the therapy office is safe, the survival brain is still operating on old programming. It's like a smoke detector that's just stuck on high sensitivity.
That is a perfect analogy. And that's what Porges calls the neuroception of danger.
Exactly. It's an unconscious risk assessment done by the nervous system itself. It's listening to all the safety cues, your tone, your facial expression, the silence. And if those cues don't scream safety, or worse, if they echo a time they were unsafe, the system just shuts communication down. The goal is damage control.
And what's so tough for them and for us is that because it's unconscious, the client often doesn't even realize that it happened, let alone what happened.
Exactly. They just suddenly feel foggy or numb. And then they're left with this intense confusion, thinking they're flawed because they can't understand why they keep doing this. They mistake it for a personality trait.
So if the client is basically lost in this neurological fog, we, as the regulating presence, we need to become expert trackers. So let's talk about catching this early. What are the really subtle signals?
We have to become masters of tracking arousal states. If you wait until they're totally frozen, it's so much harder. The source material points to a few critical shifts.
Okay.
One is just conversational speed. A client who was talking freely suddenly shifts to these brief, almost curt yes or no answers. The verbal energy just plummets.
In the body, of course. The body gives it away. Not just the big stuff like arms crossing, but the slight drop in muscle tension or the shoulders tensing just a fraction.
Absolutely. The gaze dropping to the floor a little more often. Also, watch for subtle conversational patterns. Are they suddenly steering back to scheduling? Is there a new pattern of lateness? These are avoidance maneuvers.
One cue I always look for is that processing delay, that little lag between your question and their answer. It's like their system is running a quick internal safety check.
It is. And catching these signals early is everything because it lets us intervene gently before that full dorsal vagal response really takes hold.
Okay, so we catch the signal. Our immediate instinct, our helper instinct, is to lean in, to push, to pursue them with more questions, right? We want to pull them back.
But that almost always fails.
It does.
It fails because that pursuit, even with the kindest intent, just registers as pressure to the threat system. Pressure equals danger. When someone retreats, safety has to come before exploration.
So what are the actionable, trauma-informed strategies? What do we do?
The experts point to 3 core steps. First, just name what you're seeing without any judgment. Something like, I noticed something shifted just now in the energy of the room.
Second step.
Immediately give back control. That reduces the threat. We can pause, or would you prefer we approach this differently? Normalize it. Link it to the protection mechanism. Many people find themselves going blank when touching difficult memories. It's actually your mind's way of protecting you. That framing can bring such profound relief.
It sounds so simple, but doing all of that while tracking every microexpression and managing the content, that is incredibly difficult. I know I've missed subtle shifts until it's too late.
Of course, that's where dedicated reflection time is so valuable. We're only human. The article actually notes that tools like Alliance Genie are designed specifically to support that post-session reflection.
So how does a platform like that help me track those alliance signals that I might have missed in the moment?
It's almost like having supervision-like support after the session's over. Alliance Genie helps by surfacing and tracking those subtle signal shifts in engagement, moments of distance across sessions. It can auto-capture areas for growth and insight.
That makes sense. It lets you step back and see bigger patterns. Like maybe a certain line of questioning I use has inadvertently triggered that neuroception of danger for 3 weeks in a row.
Exactly. It shines a light on nuances you just can't process in real time. By tracking those patterns, you can strengthen the connection with data-informed reflection, and you do it without ever storing or recording the session itself.
Quick pause here. If integrating this high level of reflection while also managing all your documentation feels familiar, Mentalyc can help. Its AI note-taker supports your documentation and clinical judgment, freeing you up for more reflection and client care, all while staying fully IPA and SOC2 compliant. You can explore it at Mentalyc.com. Okay, let's get back to intervention. So the shutdown is happening in the body. The limbic system, the brainstem. Traditional talking approaches, they're aimed at the neocortex. They often fall short.
Right, they're aimed at the wrong target. That's why we have to pivot to body-oriented approaches that speak directly to the nervous system. We pull from somatic work, like Peter Levine's, to gently disrupt the freeze.
So what are some practical nonverbal steps we can prompt?
We have to start with grounding. Grounding through the senses is crucial. Simply asking the client to name 5 objects they can see, 4 sounds they can hear.
That pulls them out of the internal threat loop.
It does by activating different parts of the brain.
Yeah.
And then you can introduce small, intentional movements.
Which seems counterintuitive when they're frozen.
It does, but things like finger tapping or gently pushing their feet into the floor, it introduces tiny bits of safe mobilization. It signals to the nervous system the body can move, so the danger is survivable.
And of course, the breath, the ultimate regulator.
The ultimate. Breath awareness, specifically focusing on extending the exhale. This naturally activates the calming ventral vagal pathway. It sends this internal nonverbal signal of safety that just bypasses all the cognitive defenses.
It's communicating safety from the inside out. Now let's go back to language for a second. Sometimes direct questions just increase the defensiveness. The article suggests metaphors are a great bridge here.
Metaphors are fantastic. Neuroscience shows they activate different neural pathways than literal language. So instead of asking, how are you feeling right now? You ask, if your emotions were weather right now, what would the forecast be?
Exactly. And you get this immediate, honest response, like a thick fog, or it feels like I'm watching this from behind a glass wall. They were describing the state without having to cognitively process the deep emotion that caused it.
Which leads us to that crucial technique that requires so much comfort from us as therapists, shared silence.
Yes. Irvin Yellum wrote about eloquent silences. Our culture wants to fill every gap, but in that moment, silence gives the brain processing time. It demonstrates acceptance. The silence itself says, I'm here and I'm not demanding anything from you.
It's the ultimate act of respecting their autonomy.
Hmm.
You're communicating that you can stay present with them without needing them to perform for you.
And that ties right into the most powerful tool we have, which is our own regulated nervous system. Interpersonal neurobiology confirms our nervous systems naturally attune to each other. So even during the shutdown, we're actively using co-regulation.
Exactly. Co-regulation is about maintaining a calm presence, a measured tone, and accepting facial expression. For clients who never had that consistent attunement in childhood, your calm presence provides a corrective emotional experience for their survival brain.
And that's all integrated with attunement tracking, the microexpressions, the breathing patterns. It's validation first, fixing later.
Always validation first. Just noticing the shift, I noticed something shifted. I just want to check that you feel comfortable. Helps the client feel seen without judgment.
The profound insight here, and it really brings this all together, is that these shutdowns, they don't happen in a vacuum. They reflect broader relational patterns, often mirroring early relational templates.
That's the deepest takeaway. When a client disconnects right when vulnerability comes up, they're often replaying a protective childhood pattern, shutting down to protect against an anticipated rejection. And exploring that pattern gives you invaluable insight, but only once present-day safety is firmly established.
So the goal isn't just to restart the conversation. It's to use the pause as data to gently explore what might this shutdown be protecting you from right now.
Precisely. By handling that disconnection with patience and acceptance, you create a new experience that challenges their old expectations. And these moments, when you manage them well, they lead to the deepest reconnection, both with you, the therapist, and more importantly, with those disowned vulnerable parts of themselves. The relationship itself becomes the healing agent.
That is a profound thought to end on. If you want support tracking those subtle alliance patterns across sessions and deepening your reflection, Alliance Genie can help you focus your clinical judgment and reflection. Thank you for diving deep with us today.